Can I still use insulin after its expiration date? If you're managing diabetes and wondering whether you can still use insulin after its expiration date, you're not alone. Let's break down the details to help you make an informed decision. First, it's important to understand that insulin does expire, but it's not necessarily useless after that date. The expiration date on the packaging is set by the manufacturer to ensure the insulin remains potent and effective up until that point, as long as it's stored properly. There are two key expiration dates to consider: the one printed on the unopened package and the one that starts when you open the vial or pen. For unopened insulin, if it's stored in the refrigerator at the right temperature, it can often last longer than the printed expiration date. In fact, unopened insulin can remain effective for 10 to 14 months past the expiration date if stored correctly. However, once you open the insulin, the situation changes. Opened insulin typically lasts for 28 days, though some types can last up to 40 days. It's crucial to mark the date you open the vial or start using the pen and discard it after this period to ensure it remains effective. The reason for this shorter shelf life after opening is due to the exposure to air, which can cause the insulin to degrade. Proper storage, such as keeping it away from extreme temperatures and direct sunlight, is essential to maintain its potency. Now, what happens if you use insulin after its expiration date? While expired insulin isn't dangerous, it does lose its potency over time. Using expired insulin can lead to ineffective blood sugar control, potentially causing symptoms like blurry vision, fatigue, and increased thirst and urination. So, to answer your question, it's generally not recommended to use insulin after its expiration date, especially after it has been opened. Always check the expiration date and the condition of the insulin before use. If the insulin appears cloudy, has particles, or smells off, it's best to discard it and use a new vial or pen. Proper disposal is also important. Never flush insulin down the toilet or put it in your regular trash. Instead, take it to a pharmacy or a medical waste disposal program to ensure it doesn't pose environmental or health risks. In summary, while insulin can last longer than its expiration date if stored correctly, it's best to follow the guidelines for opened and unopened insulin to ensure your safety and the effectiveness of your treatment. Always check the expiration dates and the condition of the insulin and dispose of it properly when it's no longer usable.